இந்த கண்ணு என்ன பண்ணிட்டு இருக்கிறான்? Hi friends, hello everybody, good morning. So we're back from Richardson's Face Hospitals. I'm Dr. Sunil Richardson and I'm more than happy to answer all the questions and queries and concerns and doubts that you have regarding any aspect of facial surgery, maxillofacial surgery or facial plastic surgery. I also have a few questions with me which a lot of our subscribers have been asking us, so I will be addressing them as well, and I'll also be waiting for your questions so I can clarify them one at a time. Alright, so one of the common questions that I have encountered that has been told to me in the last few weeks is about these implants. When I say implants, any foreign material that we use on the patient's face. So see, there are different types of implants. It's a very loosely used word and there are so many issues concerning this. And because a lot of the questions and concerns and issues and problems patients are facing with relation to the broad topic implants and the many questions, I thought I'll address that upfront before we start taking more questions relevant to anything on this particular area or anything else in the face. So broadly, I wanted to say that one group of implants are those that are made with this titanium, or earlier used to be made with even stainless steel. These are generally plates and screws. So that's a big group of implants or foreign materials that we use on patients' faces while we do different types of surgeries. Now, this is a big sect of the overall implant group. These implants, there are various German companies like Martin and Leibinger and American Synthesis and good Indian companies also like SK Surgicals and others. So these produce very good high quality titanium, medical grade German quality, which is one group. We also have other type of inferior materials which I don't recommend people to use anymore, but they were used decades before, especially stainless steel. Now, when I talk about stainless steel, we still at times use stainless steel wires or clips, as you can call it, for various positions in the jaws, especially around the teeth. Sometimes these wires are also used between bones for temporary reasons. So they also come under the implants. Now, moving from these type of metallic implants, you also have a very rare kind of implant made of gold, and we use it only for the upper eyelid. We use a gold weight, and that's also an implant. The other common implants that are being used are the implants for the soft tissue. So, people want to get chin augmentation or sometimes cheek. So they use a lot of silicone. And silicone has been in market for several decades. It's proven to be not reactive or doesn't cause infection or anything, but it gets encapsulated and therefore it does have its own set of problems. So that is another group, silicone. Then we have today what is called as PEEK. So it's a type of acrylic which is basically PEEK. We use this again in the different parts of the facial skeleton for forehead contouring, for eyebrow, for ridges in both the eyelids, under the eyelids, and for the piriform rims, for the chin, for the angle, for the jawline, many areas. Then in between we also have med pore. which is a material that we in between both of this peak and silicon, wherein the soft tissue grows into it. We use that mostly for some ear reconstruction. Some of the surgeons use it for the nose, and so on and so forth. Now, in general, remember this as a rule. At least I am a very big proponent of this. Whenever implants should not be used, we shouldn't use them because it's a foreign material. Now, when you have to use it, like when you are doing jaw surgeries, there are situations when we have to use these, and so when we have to use these, then sometimes there is no other go. So then it's better to use the best type of implants, and we use it in the right places, and then all of these implants stay inside the patient's faces for an entire lifetime. Now, when you use implants, the first thing that you need to be careful is about infection, and this usually happens in the first week to 10 days. After that, with time, once it heals, then the body kind of osseointegrates. At this point, I also have to tell you about dental implants, because they are something that are placed in the lower jaw, upper jaw, on which the tooth are placed. They are also foreign. They are also usually made of titanium, and they tend to be stronger than the other implants because of the way it is made and because of a quality that is called as osseointegration. Means it gets one with bone. So the bone grows within this implant and makes it even more stronger. But still, the concept of the care that you have to take for infection and everything is the same. You're going to be careful. All right. So I'm going to talk about other questions that you might have. So there are a lot of questions that people are asking also with relation to whether these need to be removed. Now, yes, sometimes these have to be removed when you're having problems with them. If there's an infection, or if sometimes in rare cases they can be felt either under the eye or on the corner or wherever, then we could remove them. Or in some patients, patient might have some hypersensitivity or some kind of allergic reaction with that. So, and these are the reasons when you would want to consider, but please consult your surgeon before you get it removed. Harish, I have just seen your question about preparing for maxillofacial surgery. So it's a very wide spectrum of surgeries that we do under maxillofacial surgery. You want to prepare, I don't understand what you're talking about. Are you preparing to study, or are you preparing to get some surgery done for yourself? And if it's some jaw surgery with plates and screws, I just mentioned some points regarding that. Oh yeah, the recovery surgery, Harish, usually takes a few weeks, because bone takes, remember, minimum of 4 weeks to heal. And in jaw surgeries, we're making cuts in different areas sometimes. So I would recommend 6-7 weeks at least for good healing. Now, Lofi, you're asking about fibrous dysplasia. Fibrous dysplasia is a type of a fibro-osseous lesion that can happen anywhere in the human body. When it happens in the craniofacial skeleton, we call it craniofacial fibrous dysplasia. This is not very rare. We do a lot of these patients with fibrous dysplasias. The thing about fibrous dysplasia you have to remember is it is not malignant, so it's not a cancer, so it doesn't threaten your life. However, it's an aggressive, benign tumor of the bone. Therefore, it needs addressing as soon as possible. Probably not the next day or the next week, but I think as soon as you can, because these grow slowly, and as they grow, they deform the bone shape, they affect the functions around that, and so it's best we treat them as soon as we can. Now, when we get a tumor like that at Richardson's, we try to make sure to the maximum possible extent to not just remove the tumor and clear the disease, but also maintain or augment your aesthetics functions that have been distorted or deformed because of this disease. So that's something you will have to remember. The next question is about totally different acne scars. Now, acne scars, we have an excellent team here, headed by a dermatologist. We have cosmetologists, we have different lasers happening. Now, I'm only handling the surgical aspect of this. So severe depressed acne scars, when they are there, far in between, not very close by. Some of them are amenable for surgical revision, not all, very few of them. If your acne scars can be improved with surgery, we will let you know. You can send in your pictures to WhatsApp. But if not, we have other options, right from threads to lasers to so many other treatments, including dermabrasion and laser resurfacing. So do let us know. We're able to take care of a lot of patients with severe acne scars, with all types of acne and acne-related issues on the face. So do get in touch with us, and I'm sure you're going to be satisfied with our expert team here at Bangalore and Richardson's. So, well, big fish, you're saying they're going to have pain after the surgery. Now, yes, but then pain is something, remember, we can manage very easily. So we have good medications today. A lot of the times, patients experience pain is because they don't let us know immediately after anesthesia especially. So pain is not something you're really worried about. We can take care of that pretty efficiently and very effectively as well. So nitrogen, and I learned that your baby could be born without with a cleft lip. So don't worry about that. Do get in touch with us once your baby is born with some pictures and reports from the hospital. I have to tell you at this point that cleft is not, it's just a variation in human birth. So please don't be upset and paranoid or crying or things like that. Be of good cheer. We can take care of your baby, absolutely making sure that the baby is just like any of the individual without a cleft. And honestly, in my experience of now around 25 years, and having treated several thousands and thousands of these cleft kids, trust me, they're brilliant kids. They're just like anyone else. And I don't want you all to be upset with the cleft. We are here to take care, and you're going to have a great time with your kids, so don't worry at all about it. So, the best time for cleft lip surgery is when the child is around 5 kg weight. Even a little bit less is all right. Earlier, people used to say about 6 months because weight was not a very predictable measure. But today, we like to do it around 5 kg, even a little bit lesser is all right. We have expert anesthesia, pediatric anesthesiologists, and so the risk of anesthesia is next to minimal. So we can do it even earlier, around that time period. So don't worry about that. Now the other question they're asking is about sleep apnea. That's a large spectrum. That's a big topic. We're handling a lot of patients with sleep apnea, also with our expert team of ENT surgeon and chest physician. So do remember, it's a teamwork. We also have an orthodontist who sometimes puts appliances for patients who have very mild issues. The sleep apnea is first started with the diagnosis. So unless you have a clear diagnosis, and then you want to know why it is there, and then you go into the treatment modalities. So right from a bimaxillary surgery to a septoplasty, to a CPAP machine, to different distractions on the nasal base to increase the width of the piriform rim. There are different procedures. We do them all here, and you have an excellent team here that can take care of various concerns. But yes, that's a different topic all by itself. And sleep apnea is a functional issue. You need to look at it seriously. People with sleep apnea have a lot of day-to-day problems that can be resolved. They're low energy levels, they're low concentration levels, high risk for strokes and blood pressure. All of this can be absolutely cured. So it's something that we can absolutely take care of. And so it's something that's really, really useful. And so the complications in facial surgeries, well, again, it's a very, very vast thing. One of the things I started off with this live thing was about implants, because a lot of our patients and people were asking us queries, and I did mention to them about that time about infection. So I think that's still one of the high complications of facial surgeries: infections, bleeding, nerve injuries, dental injuries, bite problems, things like that can happen. So obviously you got to choose your surgeon, choose your team, make sure that you get it done at an expert place where people have a lot of experience, and more importantly, get the right procedures done, do your research, and yes, take care even after all of that, because anybody after any surgery can get infected even if you take care of all the precautions. So these are all the things that you would do in order to make sure there aren't any complications after facial surgeries. Alright, so I have pretty much answered the questions that have been asked for today, and I think I have also answered about the implants that was asked before. At this point, I also want to stress about the dental implant treatment that we have here, because I did just touched about it, I did not elaborate. So dental implants is a beautiful way to get your teeth back just like the way it was before you lost it for whatever reasons. And it's again a big team that takes care of you. We need to have cone beam CT scans and so many scans for your teeth. We have a CEREC machines and other scanners, dentsply, and so these are important orthodontists and in-house prosthodontists and other specialists who will be able to take care of your dental implantology needs. It's also part of smile designing. So all of this go with the smile with your natural teeth, so you will be able to have. Again, there are time periods for healing, and to know more about it, please contact us on our WhatsApp number that we are going to give here. It's also there on our website. You can check our website out. You can check us up also on Instagram, so where we will get different feeds and inputs and informations about the facilities that we have here. So this setup that we have here in Bangalore is now a few months old. We are running regularly. We've got state-of-the-art operating theaters and ICU, that is a neonatal intensive care unit, ICU. We have about 78 beds for the patients to stay. Various specialties that we are dealing here, apart from facial plastic surgeries, oculoplastic surgery, ENT surgery, anything basically in the head and neck, reconstructive surgery, cosmetic, aesthetic, dental implant surgery, dental surgery, hair transplantation, remove the unwanted hair. So the works, everything. So it's a comprehensive team that we've got set up here. This is also some of the commonly asked questions. They're like, doctor, we want you to take care. And I tell a lot of my patients that, see, we have each and every member of our team at Richardson is, if not better, as good as me. So you can be absolutely sure about the quality of work that you will get here, about the commitment, and about the absolute dedication, sincerity that we have towards treating you. And if you have any concerns, like I said, in any of these aspects, you let us know. We can have different consultants come and also explain. Do visit us. We're not very far from the Bangalore airport. It's about 25 minutes. So you could come anytime if you're in this city, the Silicon Valley of India. You can meet with us and we'll be more than happy to have a consultation. We will show you around. And so, Petwal, again, you were asking me about infections or complications. Hi, Vindan. About jaw surgery. I just explained about this today. So you have to be careful about preventing infection immediately, and the surgeon and his team has to make sure that you don't have any dental occlusal issue, any nerve issue, or any other infection or bleeding that can happen during the time of surgery. So if it's planned well, if it's executed with the proper team, and I think you do not have to worry. It's pretty safe, predictable procedure, and so don't worry about any of that. All right. So someone wants to know also about the cost of these surgeries. Good question. So you remember, cost is something that depends on what we're going to do. Also depends on the amount of stay at the hospital, the medications that you will receive, the length of the procedure, so on and so forth. There are multiple factors. We have 3-4 dedicated numbers now. We're probably going to give you more than 2. So you can call us there, send your pictures, because if you simply tell us what's the cost for jaw surgery, it's going to be difficult because you have a huge range for this, depending on what we do, depending on the difficulty, and I mentioned about various factors, the cost will vary. So you can send us your pictures or some idea about what you want, and then me, the other doctors and the team, and the other members of our team will help you with an estimate. And that's the best way to work. The second thing is, sometimes, we give an estimate based on photographs or whatever, video consultations, but it's not as clear as when you see your scans. So I still think that when you're thinking of a major surgery, if you're not very far away, and if just making a couple of hours trip, 2-hour setup, it's really worth it, because you can meet us, you can see the facility, you get a bird's eye view, you get a personal experience before you decide to get a face-changing, life-changing major surgery, right? So I think that's more important. So yes, I think I've got a question now from India. You're saying about Tosis. So Tosis is when you have a lid lag. This one is the lid issue. So we can correct that, and you will have to send sometimes come over directly, so we should be able to take care. It's usually day care, so we would do it and then you can go back the same day. Yes, it's a pretty straightforward procedure, and you should expect good result unless we tell you that okay, you can get 80% or something like that, otherwise you should get good symmetry. So yes, we can do that also. Shiv, you're asking me about when you can get back to normal work. So I did mention earlier that about 6 weeks is what you got to keep in mind before you probably get back to playing cricket or swimming or gymming. But then if you're working as an IT professional or some job where you don't need to meet a lot of people, then you can get back to work after 10 days. Yeah, so that's easy. So what can I do to speed up the recovery process? Right, so like I said, if you do jaw surgery, bone needs immobilization for faster healing. So if you don't go about speaking, if you give yourself good rest, good nutrition, proper fluids, proper medication time to time, avoid alcohol, things that you should avoid, we will tell them, I think the healing will be fine, quicker. So I think that's one for speeding the recovery process. The other thing is, plan the surgery correctly, get it done with a team that's expert, because the healing and the recovery also depends on how the surgery was done, how less traumatic or atraumatic is not a real word. You can do it less traumatically, but not atraumatically, because whatever you do is some trauma. So depending on that, and also depending on how long your anesthesia is, your surgery was, and so on and so forth. So it's multifactorial, but I think all of these things do help you. Alright, so I've answered all the questions. Okay, what's the success rate for jaw surgery? So at here we have a very high 90% success rate, very high. So it's close to 100%, meaning if 100 patients come to us, you can expect 98, 99% of our patients to be very, very happy with the result. Few percentage, 1 or 2 percentage of the people sometimes need some more care, either because they have slight asymmetry, or 1 or 2% have some problems with their implants, or some of them might take longer to heal, or then some of them might have to get some dental treatment, which could last 6 to 9 months. So that's the thing. But yes, a very high 90% people are totally satisfied with the jaw surgery. We've literally done thousands and thousands of these cases over the last 2 decades, and we've documented thousands and thousands of them. So I don't think you'll be worried about them at all. And so yeah, just let us know the concern, we can take it up. And so is it covered by insurance? Not all jaw surgeries are, but some are now. And so you have to find out if yours is. If you're doing it for cosmetic surgery, sometimes it's not covered by insurance. But if you're doing a jaw surgery post-accident, definitely covered. Post-cancer, definitely covered. For sleep, sometimes yes. So it depends. If you're not able to open your mouth, yes, it's covered. Depending on the condition, why you're doing these jaw surgeries. Jaw surgeries is a very, very big umbrella term. Just like I started off this with implants, very, very broad term. Yeah, so we can, I think I have a separate live session on jaw surgery, because I think a lot of our questions are concerned to jaw surgeries, patient-specific implants, and so on and so forth. So that maybe the next time we come online to maybe address the jaw surgery issue. So, all right, take care then. I've got a question about square face or round face and how we can change that. We can absolutely change a square face. The proportion of the face gives aesthetics. There are three fundamental pillars of facial aesthetics, as I put it. First is function, symmetry, and proportion. So every face can be made more aesthetically appealing, more beautiful by working on the proportion. What is this proportion? Length to width, proportion of the nose to the face, proportion of the lips, everything. The whole face can be divided into so many golden ratios. That's a big topic. I can talk about that maybe on another live session. So we incorporate all these aspects into our surgery in order to get that kind of result for you. So if you look at so many of my face makeover cases, wherein we do hard tissue work, soft tissue work, a lot of maxillofacial, plastic surgery, everything in one go, work around the nose, the piriform rim, the teeth, the upper jaw, lips, nose, jawline, chin, everything. So this is actually, the foundation is the proportion. So if you have a square face, then we find out why is it square. Is your anterior length less? If it's length, we're going to increase the length of your anterior face. Is your posterior face too long? Then we'll reduce it. Is it too wide? Then we'll reduce the width. Is it too narrow? Then we can increase the width. So everything can be done. Done safely, done predictably, and done mostly for life. Because these things are changing the fundamental foundations of your facial skeleton, and therefore that stays for life. So that's something we do a lot of it, changing square face, making it angular, jawline definition, facial slimming, V-line, different terminologies, all at the end of the day to get you that face that's a little bit more attractive, that has the golden ratio, the golden proportions, and that can be tweaked for each face. So absolutely, we are into this for several years, several decades now, so we can absolutely do that. We do this on a regular basis, be it if you have an accident, be it you have nothing. I mean, it's always possible. All right, so by then, I've answered all the questions for today. I'm almost exhausting my 30 minutes. I hope this was useful, and if you ask me more queries, I'm more happy answering them. I'm happy I finished all the questions that I had for today, including the main topic I wanted to start off with. Do contact us. We prefer WhatsApp. You can also contact us on YouTube messaging, Instagram, website, many options. We can do online consultation if required. Me and my team will be more than happy to do that. Direct consultation, I welcome each one of you. And have a great day. God bless. Bye-bye.